Facebook Live for Melbourne IVF. This is Dr. Raelia Lew, and I am excited to be going live to talk about genetic carrier screening. So welcome everybody. I was just mentioning that it is my first Facebook Live experience, and I'm so excited to talk about genetic carrier screening, which is a topic that's very, very close to my heart and something that I think is important to consider for any patient contemplating a pregnancy, regardless of whether that pregnancy is naturally conceived or conceived with assistance through assisted reproductive technologies like IVF. I'm doing this live from my home, so forgive me if I have any little people interrupting me at any point in this recording. They've been given instructions to stay out of this room, but you never know. So look, I'm excited to have any questions that anyone has about reproductive screening. And I'm going to talk a little bit first about what carrier screening actually is. So genetic carrier screening refers to checking the DNA of parents before they have a baby to see if we carry a lethal mutation that could be passed on to a baby, causing a genetic disease. What we're looking for most of the time is recessive conditions. So what a recessive genetic condition is a condition that we carry silently in our genes, and we have one bad copy of a gene in question. Now, interestingly, we all carry approximately 5 lethal mutations from recessive conditions, but women who carry a predisposition and men who carry a predisposition may have no family or personal history, and that's usually the case because these conditions can be quite rare. If we do happen to get together with a partner who has the same condition that we do hidden in their DNA, or choose a sperm donor with the same condition that we have hidden in our DNA, that's when 1 in 4 babies born can have no good copy of the gene in question and might present with a recessive genetic illness like cystic fibrosis, spinal muscular atrophy, or an X-linked condition like Fragile X. It's one of these things that is very new. As technology has become easier to access, we are now able to screen for literally hundreds of conditions before getting pregnant. It's not considered routine care and it's not funded by Medicare. So it's currently a private choice that couples make before starting a family. But that may change. We are so excited as part of Melbourne IVF to participate in an upcoming study called Mackenzie's Mission, which is a rollout of preconception genetic screening to 10,000 Australian couples that will access this screening for free and will be able to, if found to be carriers of a condition, access IVF with genetic testing for free for 1 round of IVF. So I just have a question pop up from Julie. Hi, Dr. Lew. What are my choices if my partner and I are carriers of a genetic disorder? And how accurate is carrier screening? Well, to find out if you're a carrier, we do have lots of options of platforms, including platforms offered through Virtus Health that screen for over 500 recessive conditions. Once you've found out that you and your partner are a carrier, there are 2 pathways that you can go down to check and make sure that your babies are healthy and well and don't have the genetic condition. One of the favoured pathways is to choose to have IVF and test embryos before they are implanted and only replace embryos that are either completely healthy or healthy carriers like the parents. And this involves excluding embryos that have a genetic disease. And by this method, I've helped literally hundreds of patients have healthy babies. And many of these families have found out, unfortunately, that they are carriers by having an affected child. There's also, of course, the option of testing a pregnancy once you have conceived naturally. We can do this at about 11 weeks gestation, and it involves having a test of the pregnancy called a chorion villus sampling. That's done by putting a needle into the uterus and taking out a little sample of cells from the placenta itself. So it is an invasive test, and unfortunately it carries a 1 in 200 risk of causing a miscarriage. So it's a test that many people would prefer not to be in a position to need to do, and that's why so many people may choose to have IVF electively if they are at risk of having a baby with a serious condition. So please keep your questions coming. I'm very happy to answer any question on this topic. For those of you who have listened to my podcast, Knocked Up, I have a couple of episodes on this topic. One is very recently with the amazing and beautiful mother of Mackenzie and talks about Mackenzie's mission. So I would definitely welcome you to have a listen to those episodes if you would like to hear more about Mackenzie's mission and genetic carrier screening in general. So when we are carriers of genetic conditions and we do have screening, going through the IVF process to choose healthy babies can be actually a lot easier than it is for many patients who suffer underlying other causes of infertility. And that's because the eggs and sperm are actually intrinsically healthy and patients' fertility is normal. So it is quite often, especially if patients are presenting at a relatively younger age, easier than for patients undertaking IVF for other reasons that really do challenge fertility. And certainly, I think that if you are going through IVF for other reasons, you would be even more devastated if you subsequently found that it had been missed that you were a carrier couple for a really devastating disease. So baby Mackenzie had spinal muscular atrophy, and 1 in 100 of us are carriers for this condition. Spinal muscular atrophy is a condition that unfortunately no baby can survive with today's technology. And maybe things will change in the future, but with today's technology, unfortunately, babies with spinal muscular atrophy usually pass away before 1 year of age. And tragically, parents who are at risk in every pregnancy, and it can happen more than once. So what we do with genetic testing of embryos may be of interest. So once we've found out about carrier screening, what do we do with the information? Well, going through an IVF process involves taking medication for about 2 weeks. And during that time, we ask multiple eggs to grow at the same time instead of just one. How many eggs we can bring to the table really depends on many factors, including a woman's age and her ovarian reserve or egg count, and just how many eggs her ovaries can produce in a month. And there's also other factors like the kind of medication selected and the dose. Once we're ready, we do an egg collection procedure, which is an ultrasound-led needle-guided procedure where we put a little needle through the roof of the vagina into the ovary gently while the woman is asleep. And we tend to use an anesthetic known as a conscious sedation, which is otherwise known as a twilight anesthetic. So it's not a general anesthetic. A woman is not having a breathing tube doing the work for her. She's breathing for herself, and she's just gently asleep during the procedure and wakes up quite quickly afterwards. But what that allows us to do is make sure that the procedure is pain-free and comfortable for the woman, and it's not a traumatic experience. Then once the eggs are in the lab, when we are doing genetic testing of embryos, no matter how healthy the sperm may look, we select a single sperm and we inject that single sperm into each egg. And what that means is there's no opportunity for contamination of DNA from other sperm, meaning that we know the DNA from that embryo is definitely pure. And we're not going to make a mistake on genetic testing because of DNA derived from other sperm that might be stuck to the outside of an egg in standard insemination technique. Then what we do is we culture embryos in our lab, and we do that for somewhere between 5 and 7 days so that the embryo reaches a stage known as an expanded blastocyst. And at this stage, the embryo has somewhere between 150 and 250 cells. And then we take what is called a laser-guided biopsy, which is a pinch of cells from the outside of the embryo. And that is from the area known as the trophectoderm, which is the tissue that will one day become the placenta. And what we then know is that the cells from that area are representative of the embryo. And we test those cells to see if that baby has the genetic condition we're looking for. Now, we have copies of all of our DNA that we derive from both our mum and our dad, from the sperm and the egg. And we have 46 chromosomes, and including one set of sex chromosomes. For a woman, that would be 2 copies of an X, and for a male, that would be an X and a Y. So we actually have 2 copies of every gene that is in our body, and that is a copy to use, and it's like a spare copy, like a spare tire. So as long as we have one good copy of recessive genes, we're going to be okay, and we have that reference, that instruction manual on how to make whatever the gene product in question is. It could be an important protein or an important enzyme. We also have another copy, which may be a good copy, or it may be a copy that has a mistake or a genetic mutation. However, if a baby receives a bad copy from their mum and a bad copy from their dad, they have no good copy, and that's when they have a recessive disease. So carrier screening is really the only way that we can figure out if a person may have one of these serious genetic conditions. So again, I will call for anyone who's watching to send some questions, and if you do have any specific questions, I'd be super happy to answer them for you. When we do take embryos and test them, we don't necessarily get the results straight away. So when we do embryo testing cycles, we tend to make the embryos and test them and freeze them. And generally, it takes about 10 days to get a result telling us that the embryo is healthy or has a condition. And then we proceed to transfer the healthy embryos in a subsequent cycle. In many cases, that can be a completely natural cycle, which is the equivalent of just watching a menstrual cycle happen without any drugs or any other intervention necessarily. We do need to track the cycle by doing ultrasounds and a couple of blood tests around the time of ovulation so that we know when those really important events are happening. And then we replace the embryo 5 days after the ovulation happens, which is the time that the blastocyst would normally reach the uterus. So that is what we would do if we were genetically testing embryos. We would have one cycle to make the embryo, and we would have a subsequent cycle in order to replace the embryo into the uterus and result in a pregnancy. Anyone who's interested in preconception genetic screening and hasn't been offered the opportunity to have that screening in a first pregnancy should have the opportunity in any subsequent pregnancies. And it's a mistake to think that having had a normal, healthy baby means that you and your partner are not carriers. You still could be. So my advice is to see your GP and talk about it. Unfortunately, because this technology is quite new and it's not yet routine, there are many couples who have not been offered the opportunity to consider preconception genetic carrier screening. So I would fully recommend that anybody who's heard about it and wants to take part, go and see your GP and have a chat. And there are many platforms and many options that are open to you. And for couples planning their first bub, you can remember that the results of your testing are actually relevant to every single pregnancy. So you do it once at the beginning, and it means that you know that you are safe in future pregnancies, which is great. In terms of the tests we offer at Virtus Health, we have an amazing platform that has more than 500 conditions included, and that can test for even the most rare conditions that can affect the reproductive health of couples. So that is one option, but the current guidelines for the College of Obstetricians and Gynecologists and also the College of GPs in Australia and New Zealand recommend that all couples should consider screening for the three most common conditions of spinal muscular atrophy, cystic fibrosis, and Fragile X. And I can tell you on a personal note that my husband and I both found out that we were carriers of cystic fibrosis through preconception carrier screening ourselves, which we undertook before having our family. And what that really meant to us was a big surprise because neither of us had a family history of any sort in terms of having had an affected relative with the condition. And so it just goes to show you what I do tell my patients, that you don't just offer screening to patients who have a family history or who have a suspicion that they may be a carrier based on their genetic risk, whether they come from a smaller ethnic group. Everyone is a carrier for something. And, we are now very lucky to live in a time where carrier screening is available. So I would direct anyone who wants further resources on preconception carrier screening to the Melbourne IVF website. And if you would like to reach out with other questions about fertility, or if you need to see a specialist because you've been trying for more than 6 months and you're worried that you haven't yet conceived, I would encourage you to reach out through Melbourne IVF. And we have such an amazing group of specialists in our unit, and we all work really well together and collaborate really well together. Our real modus operandi is to offer personalised, individualised care and using our most amazing lab when IVF is needed to give the best possible patient outcomes. So if you want to reach out to Melbourne IVF, I'd encourage you to check out the Melbourne IVF website and also to touch base with us on the 1-800 number, which you can find on the website. And if anybody else would like to send me any questions or learn more about my podcast, Knocked Up, you can check out Knocked Up on Apple Podcasts, and you can reach me at Dr. Raelia Lew or at Women's Health Melbourne, my two platforms on Instagram. So I will sign out from this live now. It's been wonderful being here, and thank you for joining. And please do be in touch and feel free to send any questions after the event. And remember, genetic carrier screening is a really amazing technology, and it has helped so many women and couples have healthy families. And please do take the opportunity in the coming months, if you are a patient of any of our Melbourne IVF specialists, to participate in the Mackenzie's Mission project, which is an amazing project. And plug to Rachel Casella, who has been really the amazing inspiration behind this project, taking the tragedy of the loss of her beautiful daughter Mackenzie and really channeling that energy so positively for the real benefit of other people, to try and make sure that other couples are not in the same situation that she was in, tragically, to lose her baby girl. So I would really appreciate you all supporting her as well in her efforts and following her on her platforms. All right, take care, signing out.